So, Patrick, there's been a lot of coverage recently about this new NHS Provider Selection Regime, which is a new regime for healthcare procurement that's coming into force, or it's come into force from the 1st of January 2024. It obviously looks like it creates a new, flexible way that the NHS can procure healthcare services. Could you just talk us through it in high level?
Yeah, of course. So, NHS England, NHS trusts, integrated care boards and local authorities are all governed by public procurement law when they buy goods, works and services. This new law, which as you say came into force at the start of the year, the Provider Selection Regime, is designed for the procurement of certain healthcare services that are delivered directly to a patient. So it's not going to cover medicines, medical devices, other goods that NHS Trust and others will be purchasing. It doesn't cover other support services either, non-healthcare services. But it will move away from the default setting under procurement law at the moment, which is that there will be a competitive procurement before a contract award is made. Instead, the PSR creates 3 new direct award procedures, direct award A, B and C. There's a new most suitable provider process, and then a more conventional competitive procurement process as well. So lots for authorities and providers to get used to over the course of the coming months ahead. There's also a new process for bringing challenges. Do you want to talk about that?
Yes, so quite a change. We're moving away from the old court-based remedies regime to a new tribunal system. And that is quite a change, and it's one that is not being replicated in the wider Procurement Act that's coming into force later this year. So the PSR is doing something a little bit different. In summary, what is it? Well, it's a new and improved standstill period where providers can get their representations on what they think is wrong with the decision into the authority within that period, which is 8 working days. There are new, more improved obligations on authorities to answer those representations and provide documents where they've been requested. If the provider doesn't like what the authority responds with, this is when the panel comes in, so they can go to the review panel, which is called the Independent Patient Choice and Procurement Panel. And the job of that panel is to check that the authority effectively has discharged its obligations under the PSR and advise the authority on what steps it should take if it has or has not complied. So yeah, quite a change. There is still a court-based route for a provider, so if it doesn't like what the panel comes back with, there's always the remedy of last resort, which is judicial review, although the grounds for judicial review are a little bit more narrower than what providers might have been used to under the old law. So yeah, interesting times ahead in terms of the remedies regime.
It's going to be interesting to see how the new law settles in over the course of the coming months. We've put some guides together for both authorities and suppliers, which is available on the PSR Hub page, on the healthcare page of our website.